Welcome back. The Indian government has ramped up its testing capabilities to conduct over 1 million coronavirus tests a day. It's after the country took just 13 days to go from 3 to 4 million cases. In the past 24 hours, India has recorded more than 90,000 new cases of COVID-19, and it's been averaging around 75,000 new infections per day for the past week. The country has overtaken Brazil and is now only second to the United States in the number of infections recorded. Let's join Dr. Giridhara Babu, who's an epidemiologist and professor at the Public Health Foundation in India. He joins us from Bengaluru, which I think I'm right in saying was Bangalore. Very good to see you there, Doctor. First of all, how worrying is this surge in cases in India?
Hello, Mark. Thanks for having me on this show. This surge was expected, given that a long lockdown prepared us in terms of handling the surge in cases. So therefore, it is definitely concerning that the number of cases are more, but we have the health system response ready in place to take care of most of the moderate and severely sick people. So therefore, while the case numbers are definitely of concern, just by absolute number of cases, but if you look at cases per million, we are still comparable to most countries in the world, which means we are detecting all the cases which are, if not all, at least most of the cases out there. And most important thing about India and also other South Asian countries is that we seem to be having much lower mortality compared to the other developed nations. So therefore, I think it is important to continue testing, tracking, and also treating, and to ensure that the curve is actually contained and then bent in the coming days ahead.
So a big increase in cases, but you're saying that the rate of deaths is still relatively low. Is that true too of hospital admissions? Are there relatively few hospital admissions of seriously ill patients?
Yeah, that's a good question. So in most of the metros, currently, whatever the number of beds that were designated for COVID-19 patients, at least 30% of these beds are free, which means that a great proportion of people are either staying at home or relatively asymptomatic or mild illness, which is around 80%. So in the remaining people, there has been advances in the medical treatment in the recent times, and all these treatments have been made available free of cost by the union government. And also increased testing is detecting people at much earlier phase, at least in urban areas. So therefore, I think we are in a far better position now compared to if we had this surge in cases somewhere earlier in May or June.
So you seem to be saying, I mean, the main reason you think maybe that it's a younger population, that younger people are now being infected with the virus, so are not getting as seriously ill. Is that what you think? Or do you think the virus may be weakening? Is that a possibility?
These are great questions, Mark. So the lower mortality and also better clinical outcomes in India mainly because the average age of an Indian is around 27 to 29 years compared to 40 to 45 years in the developed countries such as US or UK. So therefore, the great proportion of young people tend to recover faster, and most of them have asymptomatic illness. But that doesn't mean the people with comorbidities and elderly won't get affected. They are the ones who are mostly getting severe illness and also deceased. So in order to prevent that, we need to ensure that they are reverse quarantined in the sense that the society takes responsibility to protect the elderly and also those with the comorbidities. Towards that effect, I think increased testing will improve and better treatment will improve in terms of reducing further number of deaths. Another reason is probably cross immunity with other types of viruses and also innate immunity that is there prevalent in the Southern Asian nations has a role, but it's not clear. And also there is some implications for the viral load at the time of infection and also probably some genetic reasons. So there are multiple hypotheses out there. We clearly don't know, but one which stands out with the biological plausibility is young age.
Yeah, and just briefly, 30 seconds or so, I mean, is the health system in India, is that coping? Judging from what you say, it does seem to be coping at the moment.
Yeah, Mark, again, a great question. In terms of COVID-19 response, whatever the government wanted the India to respond, I think we are coping all right. But I'm equally worried about non-COVID illness because COVID illness contribute to only 1% of the total mortality. So I wish the health system steps up its response to all the other non-COVID diseases in the days to come.
Okay, Dr. Giridhara Babu, appreciate your time. Thank you very much indeed, and we wish you, of course, the best of luck. Thank you very much.
Thanks for having me, Mark.
This is the News Hour with me, Mark Austin. Coming next, a teenage boy arrested.